Hi everyone, just want to make a video here today. I'm going to be putting in another video with the video of a very good vet called Dr. Tracy. You can find her on YouTube, Dr.Tracy Veterinarian. And I'm just going back to the whole topic of euthanasia here in Ireland, and in particular inhumane euthanasia. And just looking at her video, it's a very good video. I find her videos very good and it's very informative. And it just explains in great detail euthanasia and how it should be done, because we know here in Ireland it's not been done properly, particularly in our case. Lexi, who was euthanised by heart stick euthanasia, fully conscious, and she died a horrific death in excruciating pain, and she suffered immensely. So I want to just put this video out there because there could be a lot of people in our situation today, you know, their animals are getting old, or their animals are suffering, or they have very debilitating or end of life, I suppose, illnesses, and they're going to have to reach this stage and make these very, very hard decisions. And I find that this video will be very good, very informative, and it explains exactly how it should be done and how it should be done properly, because as I said, here in Ireland it's not been done properly, and this is something that needs to be addressed. The VCI, which is the Veterinary Council of Ireland, are doing nothing about this. They know of several cases of animals and family pets that have not been euthanized humanely, and they just do nothing about it, and this is not good enough. So I will just play on the video here for you. Just take a listen, and during the video there's just a few parts that I'd like to just stop and discuss with you. Okay, lovely.
Pet a shot. That first shot is generally, for most places, a sedative, a muscle relaxer, and a really strong pain medication all together in one. As far as pain, that shot's not much different than if they were to go to the vet clinic and get a shot for a rabies vaccine. However, in the home, we can't explain to your pet that we're giving them a vaccine, and very few pets get shots in their home. So it can be a little shocking, especially to cats, to get this shot. Some animals will react for a minute, but most of them get over it pretty quickly. I personally, if they're still eating, will bring a really special treat like a cheeseburger and try to feed them that as a distraction. And my hopes is that they're so excited about the food that we're feeding them that they don't notice the shot, or my hopes is that they go right back to eating after we give the shot and kind of get over it quickly. So that first shot for most pets is going to put them into a nice deep sleep within about 5 to 10 minutes. Some animals are a little quicker, some are a little slower. I always tell clients that there's the books, and unfortunately most animals don't read the books and they throw them out the window, especially cats, and they do whatever they please, and we just to adjust and allow them to do whatever they want. However, most pets are asleep within that 5 to 10 minute window. Now for our company, we are looking for a very deep, relaxed sleep. We don't want any more pain, any more anxiety. We want them basically in a moderate anesthesia level. Once they are asleep, we will tuck some potty pads underneath them. Some animals will relax to the point where they could let go of a little urine, or some will even have diarrhea just because of the stress of what's been going on with whatever disease they're dealing with, or also the extra special treats that they've been getting the days before if they were still eating. I also like to let owners know that almost all of our pets, especially cats, will fall asleep and pass with their eyes somewhat open. It can be very upsetting for people if they're not prepared for that, so I do like you to know that ahead of time, especially if there's kids, because we'll say they're asleep and their eyes are wide open and kids are looking at you going, I don't think that they're asleep. They may still blink on occasion after that first shot, but it should be really slow and sluggish. Honestly, for our cats and most of our small dogs, they completely lose that little blink reflex when you touch and pet around them. Once your pet is fully asleep, the doctor will come and check them and make sure they are very comfortable. Usually they'll do kind of a little pet around the eyes and make sure that that's slow and sluggish. I always give a little tickle to the ear to make sure that little ear reflex, or a dog doesn't shake its head because they're still feeling that. And then lastly, because most of our animals hate their feet being touched, I sit there and I tickle their toes, and I actually give it a pretty good pinch. We're making sure that that deep pain is gone and that that pet is in that really good deep anesthesia.
Hi, just wanted to pause the video there just to talk about making sure that your pet, your animal, is at the proper level of anaesthesia before the euthanasia commences and goes any further. And she just talks there about very simple but very effective techniques of the eye blink and the toe pinch, just checking the reflexes, and that's very, very important, and particularly in heart stick euthanasia, which I want to say I'm fully against. But if heart stick euthanasia, by law, this should be in law, the animal must be at a surgical level of anaesthesia, unconscious level. And how does a vet know that? Well, it's very easy. They just need to do those 2 simple reflex tests there with the eye blink and the toe pinch. Very simple, very easy. But as we know, this has not been done in Ireland, and we'll continue on with the video.
Some vets do not sedate. They'll bring your pet in back and they'll place an IV catheter in their leg with a technician helping to hold, and then they'll bring the pet back into the room. Now, please know that you have the right to request a sedative being given prior to that IV catheter being placed. It probably will mean an extra expense at the vet clinic, but I think it's far worth it. Yes, your pet is going to be in a very deep sleep and they're not going to be responsive to much, but at the same point, it's also taking away that anxiety and that pain of being taken away from their owners, and also of having an IV placed. A lot of vet clinics nowadays, and when I worked at the vet clinic, I actually did everything in the room right in front of the owner, which is something you can ask. I'm not sure that every vet clinic will allow it, but it is certainly something that you can ask as well, which might help ease some of your pet's anxiety too. Now, I'm using Gus as an example again, but this is something that's good to show kids. Next, what the vet will do is place a little tourniquet on their leg, and they'll actually shave a little spot of hair to make sure they can see the vein better. Now, as you can see, I don't have this very tight, but neither the tourniquet nor the shaving hurt. However, if your pet wasn't asleep, they'd pull back their leg like Gus is doing, or even turn and give it a dirty look. If they react to it, we should stop and wait and give them more time. This allows the vet to have some blood pressure so they can place an IV in that vein that's sitting there. So I took the tourniquet off because Gus was freaking out about it. However, this is what it's going to look like when your vet places an IV. And it's a good thing to show that to kids too. Basically, all it is a little plastic tube that goes into the vein. And then this is just a little plug. So I like to tell kids that if you're seeing any needles poking your dog, it's just poking this little plastic piece. Most kids seem to accept that. Now, when the vet is placing the IV, sometimes there can be a little flash of blood. So I usually try to cover it up or have the kids look away or step away for this part. Also, with the sedated animal, a lot of times they're already sick and their blood pressure is pretty bad. Then we sedate them and make their blood pressure even worse. So many times it can be a little difficult for a vet to find a good vein to place an IV. Either way, make sure that you know that your pet is, and your kids know that your pet is very comfortable and they're not feeling this, just in case the vet has to try multiple ways of getting that IV in or different legs to try to get a good vein. Now, after the IV is placed and once the family is ready, we will give that last medicine. That last medicine is either pentobarbital or usually Fatal Plus. They're both medications that are going to put your pet into an even deeper sleep and help them to pass more peacefully. They're usually an odd color, like a bright blue, a brown, or even a bright pink color. A lot of kids don't want to see that, so I actually will put a towel over it and give it underneath the towel so nobody has to see that. But a lot of clients will ask, what am I going to see? And I like people to know what they may see as their pet passes away so they can focus on being there for their pet and not focus on what their pet is doing. And at the same point, kids need to know that their pet is very comfortable and everything they're doing is normal passing, and it's nothing to be scared about. So the first thing I like clients to know is that this last part goes very quickly. So usually by the time we're done giving that last medicine or a minute or so afterwards, their pet has already passed. They need to prepare for that. Almost every client, even though I tell them that, turn to me and say, oh my gosh, that was really quick. And it is really quick. So you want to be prepared for that part and have your time to say goodbye before your vet gives that. Some pets, as they pass, they'll just stop breathing, and that's all we'll see. A lot of pets look like they stop breathing, and then about 10 or 15 seconds later, they'll start taking some very deep panting breaths. All that is the deepest of sleep, nothing more. Some animals will stretch out their legs, or they'll flex them in right as they go, which is just a muscle reflex. And some pets actually can do what's called reflexive breaths after they pass. And it can be right as they're passing or minutes after they'll pass. They'll actually take a big type breath like that, it'll make everybody jump. It looks really dramatic, unfortunately, and it actually looks like the animal is gasping. All it is I like to explain it as basically a hiccup of that diaphragm. That muscle sometimes figures it out a little later, and they could do multiples or just one or two, but either way, their pet's not feeling that. It's all end stage passing, and many times after pets do that, it's usually after their heart's already stopped. So it is a normal reflex. Other things people and kids especially should know that they can see afterwards. Sometimes, especially cats, you'll see the little hair on their tail kind of expand out and stay puffy. And then also at the same point, sometimes we can see little muscle twitches or nerve twitches, especially around the nose or face. And sometimes if pets were really tense before they pass, you can see it along those big muscles of the spine or even sometimes in the legs. Now, the one thing I want to tell people is people panic and say, what happens if you can't find an IV and place a catheter because my dog's too sick or too dehydrated to get an IV in? That's okay. The last medicine can be given a different way. Your vet is going to make sure that your pet is in the deepest of deep sleep before they would do this. But with small dogs and with cats, many times this is the way we do it, because I kind of find it insulting, especially for a cat, to shave leg after leg after leg trying to find a good vein. Most of the times their veins are really fragile because they're really old and they're really sick and severely dehydrated, so finding a good vein can be really hard. So instead, we actually can give the last medicine into their tummy under a blanket. Pets will tend to pass a little slower, so for us, we need to know it might take a little more time for them to absorb that medicine and pass away. However, for them, because we will assure they're in that really good deep anesthesia, it's not going to matter. They're not going to know the difference. Now, after your pet has passed, personally, I will take out any IV catheter and try to get rid of any doctory stuff, especially when there's kids around, so it's not as scary. If your pet has soiled themselves, usually we'll change out the pads to try to keep them nice and clean. And then usually we'll step away from your pet and give you some time to grieve. We certainly can step out of the room, or we can just back off and start working on anything that you guys want for mementos, whether it be hair clippings or a clay paw print, etc. Either way, we'll give you the time you need with your pet afterwards. And then when you're ready, I will personally bring all of my stuff out to the car. And then if it's a large animal, I'll come in with a stretcher. If it's a medium animal, usually we'll just have a really nice blanket for them. And if it's a small animal, I have a little basket that I'll bring in, and we'll place them in that as long as we're taking them with us. And we'll get them out to the car and take good care of them and get them to the crematory from there.
Just want to talk there about what the vet was just talking about near the end of the video there, just about if they cannot find a vein, that the other, I suppose, methods of euthanasia. What's very important to that video is how she talks about the animal being comfortable. It's very important that the animal is comfortable and that they're not in any distress, anxiety or any pain, which means that the level of anaesthesia must be at the right level. And for heartstick, it would have to be surgical level. Why I want to talk about that is because in Lexi's case this did not happen, and we know in other cases as well in Ireland where animals were euthanised inhumanely. So we just want to point out that that does need to happen. If they can't find a vein and another method of euthanasia, because preferably, you know, everybody likes an animal to be put to sleep through the IV, but if that can't happen for various reasons, they can't get the vein for various reasons, the size of the animal, dehydration, can't access the veins blow out. It's very, very important that if they have to go down another route, that it is done humanely, that the animal is at a surgical level of anaesthesia. Very, very important. And, you know, this can be done, but the problem is in Ireland it's not been done. And this has been brought to the attention of the VCI, which is the Veterinary Council of Ireland, and they just refuse to do anything. It just doesn't seem to bother them that there's animals and pets up and down this country being euthanised inhumanely. So by watching this video, we can see that animal euthanasia, it can be done properly. Your animals do not have to suffer. They should not be suffering, because euthanasia means in Greek good death. And I suppose it is the last act that you do for the pet that you love, is you want to end their suffering. And I just want to go back again to this book, which I have been famously showing, and it is the Veterinary Council of Ireland, the VCI's book, their Code of Professional Conduct for Veterinary Practitioners. And I'm going back to this book again, going back to page 25 where they talk about euthanasia. And this is what they say. So let's read this out again, okay? Euthanasia is the act of purposely inducing the death of an animal using humane methods. And I'll say that again, humane methods that eliminate or minimise pain and distress. Its primary purpose is to relieve suffering. So if this is the case, if this is the VCI's own book, their own protocol, why are they not following it? I mean, isn't this like the $1 million question? Why are they not following it? You know, why are animals up and down the country suffering and being euthanised inhumanely? You know, I mean, I really do believe that the VCI, the Veterinary Council of Ireland, have an awful lot to answer for. So I hope you enjoyed that video. Please share it around, because as I said, there might be people, you know, that are here this evening or tonight and they may have a pet that is very sick, is very old, may have a debilitating illness or sickness, and they just know they're going to have to make these very difficult decisions. It's a very difficult decision, having to put your beloved family member, pet to sleep. And when it does happen, I think people need to be informed, they need to be educated, and they need to be able to make the right decision. And the most important thing is that their pet and animal is euthanised humanely, and that is why I'm making these videos, because it's very important to me. I don't want anyone else to suffer like Lexi suffered, or any other family to go through what we have gone through, because it has been an absolute nightmare. So it's about educating people. I feel myself that there's an awful lot of unanswered questions here in Ireland, especially as well with the vets and their level of training. How much training are the vets here in Ireland getting on euthanasia? You know, so many questions unanswered. Why euthanasia has not been done properly here? If they can do it properly in other countries, why can't we do it properly here? Why are animals and people suffering? So please share this video around, because I think Dr. Tracy's video is very good. I think it's excellent, it's very informative. I think she explains it step by step and how it should be done. It's a good video to watch, maybe before you have to make that very difficult decision. And when you go to the vets, you know, speak up. Now, when I say as well speak up, I think I suppose it's very easy for me sitting here in a chair to say speak up, because I've been in that position. And when you're in that position, it's a very emotional position to be in as well. And you know, you're not always going to do things that you should have done. And even looking back in my own case, you know, and sometimes with Lexi's euthanasia, it wasn't even planned. It was an emergency situation, and you can really be thrown into a position very unexpectedly. So I suppose really, if the vets would do their job properly, you know, I wouldn't have to make these videos. You know, Lexi wouldn't have suffered, we wouldn't have suffered. But they're not, and that's the problem. And who do I blame there most? I blame the VCI, the Veterinary Council of Ireland, because at the end of the day, it falls back on them to make sure that the veterinary industry is, you know, up to a high standard, that their vets are trained to a high standard, that euthanasia in Ireland is at a high standard, and that it's humane. That's who it all falls back to. And if the Veterinary Council of Ireland are not, you know, enforcing their own protocols, you know, we're in trouble. And the pets, most of all, are in trouble, because, as I said, all you want for your beloved, you know, family member, they are family members, you just want, you know, a good euthanasia. That's all you want, you know, quick, pain-free and peaceful. So please like and subscribe, share the video around, because as I said, a lot of people are going to be in this situation. And I think knowledge and education is key. And we also want to get the standards in Ireland up to a much higher level, and we want to see the suffering of animals and families stop. You know, it needs to stop. Thanks very much, and I will catch you in the next video. Bye.